Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, a discussion about criminalizing homelessness with Ashley Meehan. She's a Johns Hopkins doctoral student who studies what happens when people who are experiencing homelessness are forced to move. She speaks with Dr. Josh Sharfstein about what public health has to say about a key case on homelessness still pending before the Supreme Court. Let's listen.
Ashley Meehan, it is great to see you on Public Health on Call. I know you as a graduate student here at the school, but also as an expert in health and homelessness. And so I really appreciate your spending a little time with me and our listeners talking about this recent Supreme Court case.
Thanks for having me.
So can you refresh everyone's memory about what is at stake in this particular case called Grants Pass, I believe?
Yeah, so this case, Johnson versus Grants Pass, is really asking the question, is it considered cruel and unusual punishment to fine or criminalize people who are sleeping outside? So really thinking about the criminalization of homelessness.
This is a community where people have been living outside and the town is trying to just say it's illegal.
Yep.
Now, the impact of a decision would be broader than this one small town in Oregon.
Right. So this decision would have an impact for all states and communities across the country. If the Supreme Court rules in favor of the city of Grants Pass, then it would open the door for other communities to also criminalize homelessness further.
Now, your interest in this case comes from the health perspective. What are the big picture health issues around criminalizing homelessness?
Yeah, this is a really interesting situation because on one side, you have public health serving as the rationale for why we should clear encampments or force people to disperse. There are oftentimes claims of sanitation concerns or substance use, which are very real public health hazards. In the context of encampment sweeps, though, we know that people get pushed into less visible locations. Their belongings are often lost or destroyed. They may lose access to essential medications, and they may lose connection with their support team. So healthcare providers and other outreach service providers, and all of that can be really detrimental to their health.
You used a term called encampment sweep. What is an encampment sweep?
It's a good question, and everybody uses a different term for this. So when people are living unsheltered, they may set up temporary structures or living situations. People may have seen tents outside. So any kind of congregation of people who are unsheltered can make up an encampment. Oftentimes, encampments are, I call them sweeps. Other people call them clearings. Some people call them evictions. It's the involuntary relocation of people who are outside, where they're forced to move along to another location. Oftentimes it comes with loss of belongings. Sometimes it comes with criminal punishments, but it's generally the displacement of people who are sleeping outside.
Part of the argument here is even if homelessness is criminalized, it doesn't mean that it's exactly banned because people are still homeless if they don't have a place to live.
Right. Yeah. Criminalizing homelessness won't change anything about our affordable housing crisis.
So encampment sweeps. You mentioned some of the health concerns. This is a topic that you've studied.
Yes, it is. So in Denver, Colorado, a few years ago, there were surveys done with people experiencing homelessness across the city. They were asked about their recent experiences with law enforcement and being asked to move along or displace to a new location. They were also asked about their self-reported health. So me and some others did an analysis of those survey data to identify, is there an association between having been moved along by police and self-reported health outcomes? And we found that people who had reported a sweep or being cleared within the last 12 months did have higher odds of having infectious disease outcomes, higher odds of substance and alcohol use, higher odds of climate-related health conditions like frostbite, dehydration, heat stress, and higher odds of acute worsening of mental health. So reporting that they felt their mental health was worse at the time of the survey than it was a year prior.
Sort of adds up to it being a little bit disingenuous for people to say we're clearing an encampment to help with some of these problems if in fact your evidence is that they're actually getting worse when people are pushed out.
Exactly. And I think one of the questions that I ask is when we say that we're clearing encampments for public health justification, my question is, who is the public in that instance?
Tell me more about what you mean.
So when we're thinking about clearing of encampments, oftentimes I think it's out of a desire to protect the broader community or the general community. So when we're talking about public health, it's for public health broadly, not necessarily for the health of the people who are living in that encampment. If we were prioritizing the health for people living outside or living in an encampment, then we would be working to put them into housing and connect them to services, not criminalize them or push them further away.
Tell me more about the kinds of policies that could be good for the broader community and good for the people who are experiencing homelessness.
Yeah, I think there's a couple different options. Policies that make housing more affordable and more accessible are good for everyone in a community. I also think policies around healthcare access and around income are also opportunities to benefit both the broader community and people experiencing homelessness. So thinking about both a universal and a targeted approach where everyone can benefit and the people who need the most support can get the support that they need.
What kind of healthcare strategies are you thinking of?
Yeah, I'm thinking about expansion of publicly funded health insurance. So like this would be broader than a municipality level, but expanding Medicaid, getting more people covered by health insurance. So that way they're able to have one of their barriers to healthcare removed. So they're not as worried about cost, ideally. Also thinking about healthcare for the homeless, bolstering healthcare for the homeless programs and other federally qualified health centers to do more outreach and street-based medicine. I think those could be really effective options.
I want to focus in a bit on the housing component because obviously the problem of homelessness is in many ways a housing problem. Are there solutions that you think are particularly promising out there right now that if a city is looking at an issue of homelessness, you really think should be on their agenda or a town?
Yeah, so when we're thinking about encampment resolution, I think one of the things we're pushing for is really doing a human-centered encampment resolution strategy. So having outreach teams going out and engaging with folks living in an encampment or living unsheltered, identifying who's there, what their needs are, what specific support they may need, and having this trust and relationship building process between outreach workers and people in the encampment, and then getting people into housing. So over time, building those relationships, getting people into housing that suits their needs, and then allowing them to take their belongings with them.
It reminds me of a time when I was the health commissioner of Baltimore City, and there was an encampment under the interstate that was felt to be very unsafe. Like there could be fires and other things. And at the time, we wound up working with healthcare for the homeless to find housing for all the people that were there, rather than just destroy the encampment and let the people go on their way.
Ideally, that would be what happens everywhere. I have some colleagues in Houston who have shared that their outreach workers have been going out and engaging with folks living unsheltered for months. And over time, those relationships have built a lot of trust, and they have been able to get people into housing. It takes a lot of upfront investment, but I think it's worth it in the long run.
So a court decision alone is not going to resolve this, but I imagine that you're hoping a court decision doesn't make it worse.
Exactly. Even if the court rules in favor of the city of Grants Pass, that doesn't mean municipalities are required to or have to criminalize homelessness. There is another path forward. There are alternative strategies and alternative responses that would yield more positive outcomes for everyone.
Ashley Meehan, thank you so much for coming to the podcast and talking about this incredibly important public health challenge.
Thanks for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Cesiri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.